Hi, everyone. Thanks for joining us today. Today we will be going over the Medica cost plans that will be available in certain counties in North Dakota for 2026. Before we get started, we want to reintroduce or introduce, if you're new to our office, our team. So starting on the left-hand side, we have Elaine. She's going to be one of our Part D coordinators who comes in this time of year to help us run all the prescription reviews of the medications that all of you guys send into our office. Next to Elaine, we have Trish. She's going to be really the reason Bauman Financial exists. So she's our owner, head agent. She does both the Medicare, health insurance, group insurance, as well as the financial side of the business. Then we have Ryan in the middle. He's going to be one of our investment professionals. So really, if you have any financial questions, we're going to direct you to Ryan, especially if it's this time of the year. Next to Ryan, we've got Ashley, who is going to be our other Medicare and health insurance agent. She usually is going to be the one answering the phones. So if you call, you've likely talked to or will talk to Ashley at some point. Next to Ashley, we have Marsha, who is going to be our other Part D coordinator. So same as Elaine, she's going to come in this time of year and just help us take a look at all the prescriptions you guys send in to make sure everyone's meds will continue to be covered in the new year. We are going to jump over to the bulk of the information now. So again, like I said, we will be going over the Medica cost plans for 2026. So these cost plans will be available in both North and South Dakota. There's a list of all the counties you can purchase these types of plans in, as well as the maps shown. If it is a county in blue, the Medica cost plan is available for you. If you live in one of the counties in white, Medica is also likely available. It is just going to be a different type of plan. So again, one of the blue counties or the counties listed here in North and South Dakota are going to be the counties that will have this type of plan available. Okay, so Medica does technically have four different plans available with this cost plan, but really here in our office, we kind of focus on the standard, the core, and the premier plans. Typically, we don't really go over the thrift plans because, as you can see, a lot of the copays are going to be 20% of the overall bill or overall cost for these visits. So today we're going to talk about the standard, core, and premier plans. We will start by going over the standard plan. So as you can see, it is a zero premium. So you do not pay anything per month to be on this plan. You just sign up, you have coverage, and then typically you'll have a little bit higher copays when and if you doctor due to the zero premium. This plan does have an annual out-of-pocket maximum of $5,900 for the year. So worst case scenario, if you're doing a lot of doctoring, you're paying a lot of copays, as long as they are in-network providers, your copays will accumulate when and if you hit $5,900 in 2026, you will have 100% coverage, or otherwise Medica will pay the rest. This plan does not have a medical deductible, so you're not having to meet a deductible before insurance is helping pay. They're starting out, helping you right off the bat. Looking below the thicker blue line, we're going to start taking a look at our certain types of visits. So starting off with primary care physician on the standard plan, that has a copay of $15 per visit. A specialist, which we like to define a specialist as anything ending in ist. Cardiologist, neurologist, urologist, physical therapist, $60 per visit. Urgent care visits, $50 per visit for urgent care. Mental health visits will cost you anywhere between $35 to $60 per visit. Your preventative care, which is going to cover like your immunizations, screenings, and annual exams, zero copay to you as the member. On the hospital side, an inpatient hospitalization, inpatient stay, days 1 through 5 are going to cost you $400 per day as the member. And then after that, days 6 through 90 are $0 per day. An outpatient surgery or a same-day surgery where you're having surgery and getting sent home that same day will cost you anywhere between $300 to $500. There's a range because it might vary on where you're having the surgery done, such as an ambulatory surgical center where that's kind of all they do is surgeries versus a hospital. It may also vary depending on the type of surgery that you are having. So anywhere between $300 to $500. An emergency room visit will cost you $125, and that is worldwide. An ambulance ride, if you're transported by ground ambulance, it will cost you $350. And if you are taken by air, such as a helicopter, that one will cost you $500 for the ride. Taking a look at the radiology and test sides of the medical coverage here, we've got diagnostic tests with a range of $15 to $60. Again, that'll probably vary on the type of, the specific type of test that you're having. X-rays will cost you $60 per scan. Diagnostic radiology, so this is going to be things such as ultrasounds, CT scans, MRI scans, $200 per scan. Therapeutic radiology will cost you $80. Glucose monitors, test strips, and lancets for diabetic supplies have a maximum of $25 per item. If you are admitted to a skilled nursing facility, so this is going to be something that is temporary for rehab. Your copay as the member for days 1 through 20 is $0 per day. Your copay as the member for days 21 through 100 are $218 per day. Part B drugs, which is going to be something that is typically administered by a health professional. These are going to be things such as like a Prolia or cortisone injection or maybe some type of infusion. But again, there's a wide variety of things that could fall into this category. Those are all going to have a range of 0 to 20% per shot or infusion. The extra benefits with this plan. So there is going to be an annual dental reimbursement, which is $400 for the year. So you will go to the dentist, have your dental work done. You do have to pay out of pocket, with your, however you prefer to pay, with your personal checking, credit, cash, whatever it is. You will pay out of pocket. You'll get a copy of the receipt, and then you can come to our office. We have the forms on hand. We will help you fill out and submit the reimbursement form, and Medica will reimburse you for up to $400 back for the year for your dental services. Vision, you do get a routine annual exam covered at no cost to you, and an eyewear reimbursement of $100 for the year. So same thing, you pay out of pocket, get a copy of your receipt, we'll help you fill out and submit that form, and Medica will mail you a check back. The hearing benefit. You can see there's those little asterisks or stars next to hearing exam. and hearing aids. So if you look at the bottom, kind of that last slash here, the hearing benefit has to be administered through an Epic provider. If you are at an Epic provider, your routine hearing exam, your routine annual hearing exam should be covered at no cost to you as the member. And then they do have different copay levels for the hearing aids. So depending on the level or maybe like quality or tier of hearing aid you're receiving, will cost you either $549, $799, or $1,299. Again, it'll depend on the specific hearing aid you're getting through that Epic hearing provider. If you need help looking for a provider that is within that network, you can do so by searching online at Epic's website, or we can help you do that as well here in our office. Just know off the top of my head, right now, currently in 2025, Medica does not have anyone signed with the Epic Hearing Network in the Bismarck-Mandan area. So you will have to travel outside of that area, you know, if you're wanting to be at an Epic provider for hearing. Medica does also have an over-the-counter allowance. So they'll send you a catalog at your request, which is going to be administered or partnered with CVS, where you get $25 twice a year to place an order for any over-the-counter items found in that catalog. You can do so by calling, going online, or there is an app you can order from as well. So $25 twice a year for any approved over-the-counter items found in that catalog. We're going to jump over to the core plan. So like I said, we're not going to dive into the specifics of the thrift plan because overall it's just going to be a little more of a spendy plan. So we like to stick with the standard core or premier plans here in our office. So the core plan is going to be that second from the right column. It does have a premium of $98 per month, and your annual max out of pocket is going to be $3,750. This plan does not have a medical deductible. So again, your insurance is helping pay for your visits right off the bat. You do not have to meet a deductible before insurance will help. If you go see your primary care doctor, should cost you nothing out of pocket. A specialist will cost you $15 per visit with this plan. Urgent care will be a $20 copay, and mental health visits will cost you anywhere between $0 to $15 per visit. Again, this plan also covers preventative care at no cost to the member, and inpatient hospitalization or inpatient stay is $300 per stay. Not per day like it was on the zero plan, but per stay. An outpatient surgery with the core plan will cost you between $100 to $150. So again, it might depend on the facility you're having the surgery at, or maybe the specific type of surgery. Emergency room will cost you $50 worldwide. Ambulance by ground transportation will cost you $50. And if you're transported by air ambulance, it will cost you $100 for that ride. Diagnostic tests will cost you anywhere between $0 to $15, and x-rays will cost you $10. Diagnostic radiology, so again, the CTs, ultrasounds, MRIs, will cost you $125 per scan, and therapeutic radiology will have a copay of $30. Diabetic supplies, diabetic supplies with this particular plan will have a 0% copay, so you should not have to pay for things such as glucose monitors, test strips, or lancets. Skilled nursing facility care, again, days 1 through 20 are $0 per day, and then days 21 through 100 are $50 per day. Part B medication Again, it's going to be something that is typically given by a health professional, such as an injection or infusion. That is also going to have a range of 0 to 20%. That's a Medicare standard. So kind of any cost or Advantage plan you're on, very typical to see that range. This plan does also have the extra perks that come in the form of the reimbursements. Your annual reimbursement for dental work is also $400 with this plan. Again, your routine annual eye exam should be covered at no cost to you as the member, and you get $150 in a reimbursement for any new glasses, contacts. Maybe you're just upgrading your frames or even just your lenses. $150 back for the year if you use that benefit. Again, your routine hearing exam and hearing aids must be purchased through an Epic provider to get that routine annual exam covered at no cost to you. And then the copay ranges for the hearing aids, again, are going to be $549, $799, or $1,299. This plan also has a semi-annual allowance for over-the-counter items, and that will be $50. So $50 from January 1st through the end of June to spend on the approved over-the-counter items, and another $50 to spend from July 1st through the end of December on those approved items. It does not carry over on any of these plans from the first half of the year to the second half. So if you don't spend it that first half of the year, you do lose it. You'll only get, the new amount for that current half of the year that we are in. Lastly, we are going to go over the Premier plan. So the far right column. The Premier plan carries a premium of $217 per month, and it has an annual out-of-pocket maximum of $3,000 for the year. Also, no medical deductible with this plan. Your primary care visit should cost you nothing, but a specialist visit will cost you $10 per visit on the Premier plan. Urgent care should be no charge to you as the member. Mental health, no charge to you as the member. And preventative care, just like the standard and core plans, will also have no cost to you as the member. If you are hospitalized and have an inpatient stay, this will cost you $200 per stay on the Premier plan. Again, it is per stay, not per day. An outpatient surgery will cost you anywhere between $50 to $100. Again, varying from where you are having the surgery done, like what facility, as well as the specific type of surgery you are having. Emergency room coverage will be $50 worldwide, and ambulance coverage will be $0 copay to you as the member if you are transported by ground ambulance, and $50 if you are transported by air ambulance. Diagnostic tests, $0 copay to you as the member, and x-rays have a $0 copay to you as the member as well. Your diagnostic radiology, so again, MRIs, CTs, ultrasounds, $100 per scan, and therapeutic radiology is $30. Your diabetic supplies, so glucose monitors, test strips, lancets, again, 0% to you as the member. Skilled nursing facility, again, that temporary rehab stay. Days 1 through 20, $0 per day, and days 21 through 100, $50 per day for you as the member. Part B medications or Part B drugs, again, administered by a health professional, will be 0 to 20% copay, just like the rest of the plans that we went over already. Dental reimbursement on this plan is also $400 for the year. Your routine annual vision exam also nothing at a Medica provider. And for glasses, contacts, lenses, frames, $200 reimbursement for the year. The hearing network, again, you must follow the Epic provider network to receive your exam, your routine exam at $0 to you as the member. And then the $549, $799, and $1,299 copays for the different levels of hearing aids through an Epic provider. This plan also has that $50 semi-annual allowance, so $50 two different times a year to spend on those approved items found in that catalog provided by Medica. If we flip to the next page here, we do see that the cost plan can include prescription drug coverage. So on the previous page, when we went over those plans, that is the medical only side of the cost plan. So if you're on a cost plan, typically we're going to recommend you would pick up a standalone prescription drug plan. However, it is an option to include it or bundle it with the Medica Cost Plan, but you can see the premiums do increase by a pretty good little chunk there if you include the prescription coverage with the cost plan through Medica. So what was the zero premium plan or the standard plan with prescription coverage will cost you $50.70 a month. The thrift plan, again, we're not going to recommend here in our office, so we'll kind of skip that one. The core plan, which is $98 a month for the medical only benefits, will now cost $221.70 a month with prescription coverage. And the Premier plan, which was $217 per month for the medical only benefits, will now cost you $334.70 per month with the drug coverage. If you are interested in adding drug coverage, give us a call. We'll go over, the deductibles, tiers, co-pays, all of the coverage more in depth in person. But to most people, this does not apply. So we are just going to skip ahead to the next page and talk about some of the other benefits that Medica includes with this cost plan. So the first thing you can see that they include is going to be a free fitness membership. Medica is going to have their gym membership administered through OnePass, which OnePass has a large network of over 25,000 gyms and fitness centers across the US. And you can use the membership at really as many facilities as you want. So if you have a small local hometown gym you like going to, you can use it there. And then if you're in a bigger city while you're traveling, or maybe you go to Arizona for the winter, if you find a gym that takes OnePass, you can use it there as well. You do have to activate it by calling or going online to OnePass, and they will provide you with like an ID number or a code, and you'll just have to let the facility know that code, and that will get you into their gym. It is not available with the thrift plan. So if you're on the standard, the core, or the premier plan, which are the three plans we dove deeper into with the co-pays and benefits, it is included. They also have online care. You can do online visits, which is administered through Amwell. If you're someone who does not like to leave your home or maybe can't leave your home, you can do some visits virtually, over the phone or computer. There's also a health advocate and a nurse line, 24/7 access to highly trained nurses who can answer questions. And then you can see there's the savings on hearing aids and exams through Epic, which we did talk about on the page or two prior. So again, there's the co-pays listed, and it looks like they're going to go by silver for the silver model for the $549 hearing aids. The $799 hearing aids are going to be referred to as the gold model. And then the $1,299 are going to be referred to the platinum model. Again, you have the dental, eyewear, and over-the-counter items that you are able to um, purchase or be reimbursed for, depending on which plan you're on. So they're available with the core, standard, and premier plans. So again, the three plans we dove deeper into. And that's kind of it for what I've got for the details on the cost plan. If you have questions, you can sure give our office a call at 258-6644. If you want to learn more about one of these specific plans, or even if you just want to switch from, if you're currently enrolled in one Medica plan and you want to switch to a higher or lower, we'd be happy to help with that as well. If you did send in a list of your prescription medications to our office this fall, we did just start calling out over the last couple of days, letting people know what we see with their prescriptions for the new year for 2026. So our office should be in touch hopefully soon if you have not already received a call. Again, if you have questions on anything we went over today or just questions in general, give us a call, 258-6644. Other than that, have a great rest of your day and thank you for joining us.